and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. A new report has just been released by the international medical humanitarian organization Médecins Sans Frontières, or Doctors Without Borders. The report is titled Gaza's Silent Killings, and it documents the destruction of the healthcare system and the struggle for survival in Rafah. This comes some 7 months into the war on Gaza, and as the threat of a ground invasion in Rafah is imminent. So joining me on the show to discuss the report further is Mercè Rocaspana Moncayo. She is a health advisor to the emergency unit for MSF. Mercè, thank you for being on the show with me today. I appreciate your time. But before we get into the report, I'm hoping that you can provide us with maybe an overview of MSF's work in Gaza. I understand that MSF has been working in Gaza for 35 years before this latest escalation of violence. So maybe you can tell us about what MSF has been doing or has been operating in the past 6 to 7 months of this war.
Yes, in Gaza, we have been doing many different things. I mean, with a lot of difficulties, as you can imagine, but we have been supporting primary healthcare and secondary healthcare. So currently, we are supporting 3 hospitals in Gaza, part of the hospital, not complete the hospital, partial support. So, for example, we are supporting burn unit, physiotherapy, postpartum care, surgical care, and we are also supporting the primary health care. We are actually supporting 3 health centers that provides consultation for adults, for children, for pregnant women, a dressing room, mental health promotion, vaccination, all the different components of the primary health care.
All right. Okay, so could you help us put that into context? So MSF helping to operate partly 3 hospitals and 3 healthcare facilities. What is that in comparison with what was there before? And what is that in comparison with the current healthcare needs?
The health needs are huge, and we have to consider that Gaza is a very tiny place, but most of the people now is concentrated in the south. No, many people have been displaced to the south, and the health structures are not enough to cover the needs of the population. So there is not enough beds in the hospital. There is not enough primary health centers. So then the problem now is that there are a lot of needs. We are trying to cope together with other organizations and agencies on the ground, trying to see where the population is mainly concentrated and trying to cover their needs, which are very big comparing with the previous situation.
Yeah, you're absolutely right to point to the size of Rafah, 64 square kilometers and previously home to 270,000 people, now sheltering over 1 million. So you can imagine the overcrowding. The report, in the report, MSF points out that actually the devastation that has happened in Gaza extends beyond those who have been killed by Israeli bombardments. It now talks about the impact of the destruction of the healthcare system in Rafah and across Gaza. Tell me about that, the dire situation described in the report regarding the deterioration of physical healthcare, healthcare for physical needs for people of Gaza.
Yes, there are some services devoted for the victims of the conflict, people affected by trauma or by explosions, but also there is a need of other people that needs other kind of health care, because pregnant women needs to do the prenatal consultations, people with diabetes that need to do the follow-up consultations with the doctor, to receive the medicines, the insulin in this case. So there's a lot of people in need or with normal diseases, chronic diseases, or even acute diseases, respiratory diseases, pneumonia, bronchitis in children. So all these people have a lot of difficulties to access healthcare. Not all the medicines are available, and the medical structures are focused mainly on those who has problems related with the violence. For example, there is not enough beds for postpartum. Pregnant women arrive to the hospital, they deliver the baby, and they have to go home after 1 hour or 2 hours because there is no place to do a proper postpartum, which puts at risk the health of both mother and baby, no, in this very critical period of the first hours postpartum.
All right. Just give us a better understanding. What supplies are there when we talk about, crippling access to essential medical care? What basic supplies are still available? What's been depleted? Can you give us a sense?
The supply, I mean, can be done because there is a way to enter supplies via Rafah crossing point from Egypt. So there's many organizations trying to supply the different hospitals and structures, but this supply is not efficient enough. I mean, it's very small, the space that we have. The number of trucks that can cross every day is very limited. So even if there are some supplies inside, it will never cover all the needs. There is also lack of food, there's lack of water. It's not only medicines, but it's also all the logistics around. No, it took us some time to have proper cold chain equipment to keep medicines that need to be on a fridge. So this was a problem. Now is a bit better, but I mean, it's already 6 months. So I mean, for some reasons, if you are sick of a specific disease, you cannot wait 3 months or 2 months to have a fridge to receive your medicine. No, so there's a lot of things related with the supply that is not only the medicine itself, but everything that is beyond. There is some places that had difficulties to get the fuel to run out the generators, and so supply, I mean, let's say it's functional, but it's not enough. It's not efficient enough. It's not covering all the needs. So this is one of the things that we call is for a better supply system and more openness to receive everything that this population needs.
So can I ask how MSF has navigated the challenges of bringing in and providing humanitarian aid and medical supplies into Gaza? I mean, the report talked about the restrictions and the delays that were imposed by the Israeli authorities. But how did you manage to get around that? How did you manage to bring in what you needed or as much as you could?
Yeah, we are doing different orders. We have many in different cargos in different time, trying to adapt to the needs and trying to adapt to the different services that we were offering. So we started to do some primary healthcare. Now, later we started to do some secondary healthcare. So we need more things. So we have been adapted the needs to the type of services that we were offering to the population. We had also difficulties to get storage capacity because, as you said before, Rafah is very crowded. There's a lot of people all around, so it's not easy to get a place to store all the drugs. So we managed to have that. So then we are passing all our cargos via Egypt. They have to be screened in the border by the Israeli authorities. And I mean, they have a kind of list with all the items they consider that are banned. So we couldn't import all the things that we needed. There is some difficulties with some logistic equipment, with some biomedical equipment are not allowed to pass the border.
Right. We're reading reports of operations being conducted without anesthetic, operations, amputations, open wound treatment, all of that being done without any kind of pain medication or anesthesia. Has that been the observation of MSF?
Directly, we have not observed that, because when we started the activities, we had all the capacities. I mean, we one of the things that we are kind of, one of our objectives is the quality of care. So we are not doing any surgery without anesthesia. We are not doing any kind of bone care without the proper painkiller. But it's very possible that other structures, other health centers, other hospitals, where maybe they don't have the capacity to receive the supplies, because maybe they are in the north of Gaza or in the middle of Gaza, where supply chain is less efficient. They don't have enough drugs and enough capacities to do it properly. This possible is happening.
You mentioned a little earlier in one of your answers, patients who have chronic conditions. I'm thinking people with kidney disease or diabetes or asthma, people who are immunosuppressed. What has become of them with such limited access to medication?
What mainly is that some of the health centers close, because some of the staff and the supplies were concentrated in some hospitals to do the response to the victims of the violence, of the explosions, these kind of things. So then the primary health care was not prioritized, mainly at the first months. So they didn't have any possibility to go and to get any prescription. Then the pharmacy was also closed. The pharmacy was not with the proper stocks of everything. So then also there is the problem is not all the medicines are available. I mean, we are importing essential medicines according to the standard list of essential medicines, but maybe they need something very specific. So there is people that need something very specific, or combination of drugs. This is now is not available, so they need to do the adaptation. So they need to come to the health center. We have the doctors that can make the adaptation. For example, for psychiatric drugs, we have a psychiatrist that is doing the adaptations to the existing drugs, which are more essential.
Right. I can imagine maybe not everyone will have access to the very few still operating medical facilities. Are there ambulances, Mercè, there? Are there vehicles or ambulances that can reach those who are critically injured or require medical attention? I mean, how do they get to these medical facilities or these hospitals that are still operating?
Yeah, there are ambulances, there are vehicles that can do the emergency referrals. The problem is if something happened, because there is some active fighting or some explosions in the area. So of course, then the movements are restricted. So the vehicles exist, but sometimes the problem is that due to the different context situation, this movement cannot happen, or cannot happen with all the guarantees of security.
And what about MSF staff themselves? I understand that MSF's own convoy, I mean, despite being marked very clearly with the MSF logo, was hit while evacuating staff and families last year. How are the healthcare workers in Gaza surviving in this time of conflict? I mean, they clearly face the same struggles of the people of Gaza are facing. How are they coping?
Yeah, it's very difficult because our staff, which mainly Palestinians, I mean, we have some international staff inside, but most of the work we do is done. I mean, it's done by Palestinians. They are suffering a lot. They have a lot of difficulties, of course, because they are part of the community. So they have to support the population. For example, the psychologists, the psychologists, they have to provide this psychosocial support to the population, but they also need the same support because they are in the same situation. Maybe they are living in a tent. They don't have maybe enough food. During the winter, it was very cold. There was a lot of difficulties for the people to cope with the low temperatures. So it's complicated when you have to provide support to population, and you are also in the same need of support. So one of the good things is that at least they are, let's say, happy, let's say, to support, happy to contribute. So this is one of the good things, that at least for the staff, know that a feeling that what they are doing is useful, and they are contributing to the health and the well-being of the community.
The other very troubling finding of the report was the acute malnutrition that's happening. So MSF teams screening people for acute malnutrition and finding that it is emerging with alarming rapidity. So talk to me about the people who are most at risk of acute malnutrition. I'm thinking children, I'm thinking pregnant women, breastfeeding women, new mothers. How has acute malnutrition manifested in Gaza? What does it look like, and what are the risks?
Yeah, what we do in the health centers is to do a screening to all the children under 5 that came to the facility, even if they come for another, maybe they come for a vaccination, or they come because they have some coughing. So we are doing a screening to all of them. Also, we are screening all pregnant women and breastfeeding women. And we started to identify some. At the beginning, there were no cases, and then we started to identify some cases of acute malnutrition. We separate two groups: moderate malnutrition and severe malnutrition. Most of the cases we are seeing is moderate malnutrition, but without the proper support, they can become severe in a matter of days. So most of them are malnourished because they don't have enough food at home. So some of them also related with some diseases. Some of these children had diarrhea and they stopped to eat. There's not a lot of food in the house. So it's a mix of factors because the water is not good enough. It is not enough quantity and quality of the water for some of the communities. And this is a bit related everything, no? So then what we do with these children is, once they are identified, we treat them with a specific in a specific nutritional program with a specific therapeutic food. We are providing also support to all pregnant women, the youngest pregnant women, all the under 19 years old pregnant women, and also we identify if there is any women at risk. We also provide nutritional support with specific products. The trend is more or less stable. I mean, it was an increase. It's slightly increasing. It's not really a peak of cases, and it's just the cases that we are seeing in our facilities. So it's possible that there are more cases in other areas, but we cannot reach. We haven't seen. So we cannot say what's happening in the whole Gaza or in the whole Rafah. We just can say what we see in our facilities, no? That in a place that malnutrition didn't exist before, now there are cases.
You also mentioned a little earlier in our conversation that MSF provides mental health care. And I wanted to ask you what that is like in an ongoing conflict zone. How do you provide psychosocial support when insecurity and violence are ever present? Talk to me about the mental health population and mental health needs of the people in Gaza.
Most problems or symptoms that we are seeing these days, or on the people that came to our facilities, are related with anxiety and depression. So we have a team of psychologists. We are training them to identify people in need. I mean, we have, as you mentioned at the beginning, I mean, we have long experience in Gaza and also in mental health programs in Gaza. So, I mean, we know we have the expertise on how to train new psychologists to identify the different signs related with mental health in this kind of specific situations and in this area, no, in Gaza. So we are identifying the cases. We are doing individual treatment, but we are doing also group sessions. We are doing psychoeducations, and we are doing also what we call the psychosocial first aid. and we are trying to train other professionals to be able to provide these psychosocial first aids to the population. We are a lot of people in need.
It goes hand in hand, right? So you're trying to provide, you're trying to address the physical needs, but also you need to address the mental health needs of people who have been so exposed to loss and violence. How does MSF think about that, about balancing the two?
Yeah, we think that one of the things that we say is that there is no health without mental health. So usually when we start a humanitarian program in this kind of context, we always offer both things at the same time. We think it's very important that physical health is fine, but also mental health. So we are, we have the consultations in the same place, in the same health center, and we are doing by the health promotion to the community for them to understand the importance of the mental health, and we offer them the possibility that going to the mental health offices also to seek for care.
We're also reading reports that Gaza is experiencing a severe heat wave. I mean, rising temperatures will no doubt exacerbate the already challenging living conditions that are faced by residents. How might heat present risks to public health in terms of especially with the lack of water, lack of sanitation? Are you concerned about infectious diseases spreading?
I mean, the situation of the people now, the community, the shelters, depending on the areas, is very precarious. So cold and heat both are bad if you don't have the proper shelter conditions and you don't have enough water for bathing or for cleaning or for drinking. So both situations are very bad, are very difficult for the community. So I mean, what we think the most important is to call for a ceasefire, and we are very concerned about the potential offensive in Rafah, because people now is living in this. Many people is living in the area of, mainly in the area of Al-Mawas in Rafah, in tents. Maybe they are going to displace again if there is this ground offensive in Rafah. So they are going to lose some of their belongings. They have to put their tent in another place. So they are going to have a lot of difficulties to cope with all the climate conditions that will come in the near future. Heat, cold, rain. I mean, everything is terrible when you are not living in a proper place.
Right. Well, what are your concerns if Israel goes ahead with its full-scale military incursion into Rafah? How will MSF still be able to continue providing its medical support, its humanitarian aid, or will you have to evacuate your team from Gaza?
Yeah, we consider that this military incursion in Rafah is going to be a huge catastrophe. First, because the people will need to displace. The people will need to look for a safer place. We don't know exactly where the people will go. We are trying to anticipate a bit and to try to have capacities in other areas. But yeah, it's possible that we have also to be displaced the services of MSF. We have to move from one area to another and to start again. I mean, we did it in December already. We were operating in Han Yunis and we had to evacuate and we have to move the activities to Rafah. So this is going to be very, very complicated for the population, and it's going to be very difficult for the different agencies as MSF to work and to continue providing support to the population. So the best that could happen is that this offensive doesn't happen.
Mercè, in the last minute or so that we have left, I want to highlight the title of this report, which is Gaza's Silent Killings. In the report, it details that it refers to the individuals who have died as a result of entirely preventable circumstances in which their critical healthcare has been disrupted. What message would you like to leave with our audience tonight? What would you like them to know about the work that MSF is doing and what's been laid out in this report, and understand about the last 7 months in Gaza and what's to come?
Yeah, when we refer to silent killings, we mean all these people that is suffering diseases and dying, not only due to the conflict. I mean, they are not the direct victims of the conflict, but because they don't have proper health care. Babies with neonatal infections, people with respiratory diseases that cannot get their medication, pregnant women with severe maternal complications, no beds enough in the hospitals, no prioritization of other health problems. This lack of living conditions, the lack of food, the lack of proper sewage or sanitation, the risk of diarrheal diseases or the risk of epidemics are very, very, very important. And of course, this near future that we know that Israel announced this ground offensive, and we think this is going to be, very catastrophic considering the situation that we have already today. If in a few days they do the offensive, all these problems, all these silent killings that we are talking about, it will be, the magnitude would be very, very big.
Thank you so much, Mercè, for speaking with me. That was Mercè Rocaspana Moncayo wrapping up this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching. Good night.